Hi, everybody. I'm Lisa Fisher, host of the podcast here for Arkansas Heart Hospital. I'm a longtime broadcaster in Central Arkansas here with a peer of mine and a friend of mine who's left broadcasting. We're back again, clearly, but she's here at Arkansas Heart Hospital.
Yes, we are teaming up. I'm Michelle Rupp. I'm the Director of PR and Communications here at the Heart, and we're talking about a wide variety of topics. And today, I'm so excited for our guests that we have in studio with us today. Christine, go ahead and introduce yourself.
So I'm Christine Alongi. I'm the director of the Strong Hearts Cardiac Rehabilitation Program.
And what I love about this is we are talking intensive cardiac rehab. We have one of the premier, if not the premier, intensive cardiac rehab program in the state. And Christine, I mean, tell us about it. What is, I guess we'll start at the beginning. What is intensive cardiac rehab?
So intensive cardiac rehab is a fairly new thing. We are the only program in Central Arkansas currently. So it's when people have a cardiac event, have open heart surgery, a stent, a heart attack, any kind of damage to their heart muscle, we come and repair it and actually help them get healthy again, get their heart stronger to where they can do normal activities.
So if I've had a major cardiac event, but I am not a patient of the heart hospital, can I even still talk to you?
Oh, sure. Any physician can refer into a program. It can be a family practice. It doesn't always have to be a cardiologist, and it doesn't even have to be a heart hospital cardiologist.
Okay.
Now, is this the fancy building over there that I had Keep the Beat? Yes.
Yeah.
Love that. So is it in that same building upstairs?
Penthouse.
Oh, I've seen it. That's where you have, they can do cooking lessons. They can do the physical rehab.
That's right.
You've got exercise equipment, all that.
Right. So intensive cardiac rehab is 36 sessions of education, which we have two chefs that do cooking demonstrations. Everybody meets with a dietitian. We have like a mental health person too, because stress and depression is big in heart disease. And then I have a team of coaches that are nurses to exercise physiologists.
Yeah, because I would think if you just had 5 bypass surgery, your chest is cracked open and you're healing, I would think, and I'm not clinical, but I would think your life has been turned upside down and the way you had been living is no more. Right. You have to completely change everything.
Right. So like I always say, like if you have knee surgery, you go to physical therapy. So the same thing for your heart. Like if you have surgery on your heart, there's been damage. There's, it's weaker now. So we need to slowly titrate you up to where you can handle what you used to.
Because it's a muscle.
Correct.
And so we're just strengthening the muscle. I never thought of it in those terms because everyone that's had ACL surgery or whatever, they go to physical therapy. So this is physical therapy for the heart.
Exactly. That's exactly what it is. And we have marathon runners that have heart attacks. So their body's strong. They're like, let me go, let me run.
Right.
But we have them hooked up. So we're watching their heart rhythm, their blood pressure, their heart rate. And we go, oh no, your heart can't handle that yet. Your body can, but your heart can't handle you running yet.
What kind of time commitment then is involved? Because the surgery alone knocks you out for however many days, whatever the weeks are. But then if you're coming back for your 36 of this and something of that, is that a daily thing for them?
It can be. The people that go back to work after 6 weeks, we could see them every day and work with them and just kind of how they tolerate it. If they don't fatigue too much and if they recover well enough. Most people come 3 times a week for 12 to 18 weeks. I mean, it's a big commitment, but
it is a big commitment.
But we get you back on your feet. I mean, we have people. One gentleman, he lost 56 pounds, got off all his insulin, and he got his CDL license back, and he hadn't worked in 5 years.
Wow, that's tremendous.
Yeah, so in that 12 to 18 weeks, we always say this is just the launching pad. It's not like when you're done with cardiac rehab, you're done and you go back to the way you were. Like this is setting the stage for the rest of your life and your lifestyle.
So the recovery time isn't just what you do here at the hospital. Do they start the minute they get home, or are they in the hospital still recovering and they come over and see you?
Yeah. So in the hospital, actually, the day after surgery, we get everybody up and walking, get them moving first thing. And then usually we see them if you have like open heart surgery. If you have a bypass, we'll see you 2 weeks after surgery. We have you up and moving.
Are they cussing you under their breath, or are they going, Christine, I know you're doing this because you love me?
Well, a lot of the patients, it's really funny. They say I have a love-hate relationship with my coach,
But one thing that's interesting is the approach here is from a medical standpoint. The exercises that are done in the location here, and there's also a brand new location in Russellville, but you can't. Let me ask you this. What sets that apart than just going to a regular gym in my hometown?
Because you're monitored. we're watching you on the inside. We always say we're going to make you pretty on the inside. We know all of your medications because we review them with you, because there's some medications that don't let your heart rate get up. So if you go to other gyms and you keep going, why is my heart rate? And you keep working harder and harder, you actually could be overworking your heart, even though your heart rate's not reflecting that. So the blood pressure, we check it before, after, in the middle of your exercise. We check your blood sugar, and we're watching your rhythm. We have people, sometimes they're in the program 5 weeks. We hook them up to the heart monitor, and then today their heart's doing a weird thing. We send them down to their doc, and they may need another stent.
Another stent is sometimes what they're told.
Oh, yeah. So we call ourselves the eyes and ears for the physician. Like, we really catch a lot. We see a lot. So hopefully saving lives, preventing you from having another event.
So how many come in? Is there a high percentage of people that already have pre-existing conditions, type 2 diabetes, hypertension? Or, because you mentioned the marathon runner, that's probably the exception rather than the norm.
Correct.
So somebody like that, then you really are looking at a whole team of people.
Right. It's very holistic.
Endocrinologists, nephrologists, anybody that's involved in those patients.
Yep, we do. Yeah, so it's very holistic. And like I always tell the patients, we're going to focus on everything that you have control over. You can make these changes and improve your heart health and improve your health overall. So it's all the thing. We can't change your genetics.
Right.
We can't, but all these things that you can control. Yeah. But usually within 2 weeks, if people come to our program for 2 weeks, we're already dropping back on the blood pressure and the diabetic medications.
Well, you kind of bring up something that our health is in our hands a lot of times. Again, genetics is over here, but a lot of lifestyle choices we know get us to where we are. So we've talked already about the Rehab program in one of the other podcasts. But is there an education that the hospital can do to start people off going, hey, let's not be a statistic?
Definitely. I think, unfortunately, just human nature, it seems like we kind of need a wake up call sometimes.
Yeah.
People go, I know that could happen, but that won't happen to me. And then it does. Yeah. But if you have if anybody in your family has had heart disease or it runs in your family, you definitely need to go to keep the beat and to kind of be living the right way.
That keep the beat is one of the most eye-opening things I've ever done. Yeah. I found out things about myself that I didn't know was even a risk factor. Yeah. The way they scan the heart, the way they look at whether it's your BMI or blood pressure, all these different elements, the 9 tests that are involved. And again, so for me, it gave me peace of mind that I may get hit by a truck today, but I'm not going to have a cardiac event in the next, it looked at 5 years, it tells you the percentage.
Right.
Mine's low. So I told my husband, I go, I'm sorry, I'm here for a long time.
Nice.
So be nice, buy me things is what I said.
Well, we had a 40-year-old runner come in, and he just did it. He was actually a friend of Michelle's, and he had 5 bypasses. He had no idea. Thin, ate healthy, ran. You would never have known, but he would have died. He would have had a heart attack, a big MI, and died.
He lost the DNA lottery there.
Yeah. Yes. We have another guy. He's like probably late 50s, early 60s. He actually works here. His wife wanted to do it. He's like, all right, I'll go with you. She checked out fine. He needed 5 bypasses. He told his brother 2 weeks later, his brother came in and had 4. He had no idea.
He's family of bypasses.
Well,
wow.
He was like, well, yeah, I'm tired, but I'm old. You write it off.
So are those some of the symptoms? Fatigue, a symptom of cardiac event?
Yeah. Shortness of breath. Oh, yeah. Oh, yeah. Actually, an exercise physiologist that works for me, he finally talked his mom into going. She has a high-stress job. She's like mid-50s or whatever. She got 5 bypasses, had no clue.
We just talked about 9. The other thing, I can't do math, but 14 bypasses in about 1 minute here.
Yeah, it's really eye-opening. And it's really amazing because after they do this and then when they finish rehab, they say, I feel like a teenager again,
Really?
Like I think sometimes.
Gives them their life back.
Yep. That's exactly what I hear.
Really
I hear all the time.
Well,
they get back to gardening. They get back to doing the fun stuff. And we work on a lot of functional movement too. So we work on balance. We work on picking a box up off the floor, picking your grandkid up, putting it.
Come on.
Because I always say, the doctors like the numbers. Okay, blood pressure went down, blood sugar, yada, yada. The quality of life. We want them to get back to living the life that they want to live. That's the good stuff.
And talk about, because you did touch on age bracket here.
Oh, I had a 22-year-old in the program. He had his valve replaced.
Hold it.
Yeah, he was 6'4", 6'8".
Yeah.
He had his valve replaced, yeah. So he's in there. And it's a full spectrum up to like 92, it's full spectrum.
So for him, did he have symptoms? Was he feeling bad? Was he lightheaded? What makes a 22-year-old think something's wrong with my ticker?
Yeah. Yeah. Well, your valve, you can't.
So is that congenital, you think?
Mm-hmm. Yep.
Somebody that young?
He had a condition. Mm-hmm.
Yeah. Wow.
Yeah.
So I guess you do need to start asking, how did grandma die? How did grandpa die?
Definitely.
And if there are any cardiac issues, do you have any in your family?
No.
Okay.
I haven't done Keep the Beat yet, but I sure want to.
You need to.
I know. Well, I just hit the age. Yeah.
That's right. Because there is an age requirement for men. I believe it's over the age of 40 and women, I believe it's over the age of 45 because with the exception of genetics, but for most people, some of those the plaque and things aren't going to begin to show up until you hit those age markers. Right. But if you are younger than those age markers, your primary care physician, especially if you have a history of heart disease, they can go ahead and prescribe. So that maybe somebody in their 30s might need to come in and take a look because their dad had something and their granddad had something, and now they're worried the son might have something kind of thing.
That's right. So, I forgot. The guy that works for me, he's an exercise physiologist. He's one of the coaches up there. His mom went to her primary care just for her yearly. They do a little EKG. And he's like, I think I see something, but you're okay. It's nothing to worry about. So when she told her son that, he was like, I don't like the way that sounds. And then to keep the beat, and she needed 5 bypasses.
Yeah.
We're back to the number 5 on the bypass.
Yeah,
My
but
goodness.
it's just like, but her primary care was like, I see a little something on your EKG, but it's okay. Because she had no other symptoms. She's working. She's, she's healthy.
And she probably has ignored symptoms.
Women usually do.
Yeah. We're busy. She was was on her Pinterest page. I mean, she was checking Instagram.
And we're tired. I mean, who's not tired?
Right.
So it's hard to use that as a marker.
Right.
Fatigue.
Right.
So talk a little bit about, because I know we've got the intensive cardiac rehab in Little Rock, but we also have a brand new one in Russellville. How exciting is that to be able to bring that to the patients in the River Valley? Yeah.
So the cardiac rehab in Russellville is the only one in the area. So that's really exciting because we can pull from everybody. Everybody can come around there. It already has a nice buzz going around about it. And the one in the Russellville, it's the exact same program that we do here. The exact same schedule. So if we're doing cooking demo on breakfast here today, that's what the chef is doing up there. So it's the exact same program. It's not
just mirrored program.
Yeah, exactly. And it even looks the same.
Yeah.
Same quality of people, same quality of equipment. Everything's the same. Yep. Right.
So if you're in Clarksville or Danville or Russellville, you don't have to come to Little Rock. You just go to the one in Russellville.
Right. Which is so great because they come down here, like our heart hospital patients have their procedure, but then they go back up there and see their doc in the Russellville clinic. Well, now they can just do their rehab there.
Yeah.
Yeah.
So really impressive what you're doing.
Thank you.
What's your favorite part of your job?
Oh gosh. Every day. I always say we're flowers and sunshine. Every single day I come to work and I get all the glory. It's so sweet. They come to me and they go, "You've changed my life. This is the best thing I've ever done. That coach means so much to me. They have got me back on your feet. You've saved my life." I mean, hearing the good stuff, like we said, I used to be in college athletics and then I kind of go, there's more to life than winning a ball game. Like this has real purpose.
Yeah, this is the real ball game right here.
This is the real ball game. I love it.
Touch on graduation because it's very unique.
Oh, it's pretty sweet. So when they graduate, when they finish the program, they get a shirt, a graduate shirt, and then we roll out a red carpet and they walk the red carpet and they sign our gong and they get to hit it.
That's
and then
awesome.
We talk about them on the microphone and talk about their achievements and they get a certificate and stuff. And then as the gongs fill up, we hang them on the wall. So we have one for our first year. We had 2 last year that were full. And then this year.
So they're in a class then with other graduates? You begin at the same time and end?
Nope. It's just kind of whenever.
Anybody, anytime?
Yep. Every single day we're adding new patients. Yep. And just whenever they get done, we just kind of.
So is somebody's cardiac rehab maybe shorter than somebody else's? They finish all the whatever you're trying to achieve?
Yeah, they can. Like we had a gentleman come from Fort Smith. So like when he came, since he was driving so far, we would do 4 or 5 sessions in one day.
Did it wear him out?
No, he loved it because it life changed. One guy actually moved here just to do the cardiac rehab program from Florida. Yeah. His daughter lived here and he did it.
So other states, okay.
Yeah, it was pretty exciting that he did that. And a unique thing about our program is we allow caregivers to come. So it could be your friend, your sister, your child, your spouse. Because again, we really want that whole home environment to change, going here forward. Like we love you, but we don't want to see you again.
Yeah, right.
And if the husband has had the heart attack and the wife's doing the cooking and now the husband can't have the fried catfish, she's got to learn how to make.
Right.
Blacken the catfish or whatever else.
Right.
And what I've experienced more before is sometimes when the wife is the one that's the patient. If people weren't supporting in her home, she had to make 2 dinners. She had to have mom's food and then she had to have. Yeah. So it's really nice when we get everybody supportive, everybody on. And again, they feel better. So, and it's not a diet. It's just getting back to whole foods, less processed. I mean, that's really all it is.
Don't we all need that?
Oh, of course.
That's the advice for all of us. Yeah. Someone somewhere thought, well, let's put it in a box and make it easy. And then people start going, I think we're dying.
Yeah. But it is easy. Yeah. But So is eating.
Right. Fruits and vegetables, and buy chicken and do something with it. So it's probably
And our
basics.
chefs are so amazing. They can even you can bring in your family favorites, especially around the holidays and stuff, and he'll rework them to make them better fit like your health condition now.
So we can still eat mac and cheese?
Yeah.
Maybe?
He actually does that. Yeah.
Okay, then I'm signing up. Okay.
Yeah, I know.
It's just food. I mean, it's the one thing. Politically, we're divided. We can all agree on food.
That's the truth.
Food, and at least that's something I know, because I know I've toured the facility over there and I saw them. I saw the chefs there. Kobe. This was Kobe when it first opened a couple of years ago, maybe. Yeah. My radio station came over and he was there showing chopping and doing, and people were learning. I saw people in the little workout facility, so that's why I remembered that. So
yeah, it's really fun, and it gives you hope in that environment. We have a lot of natural light. The music's going. We have 7 groups a day. And I think when patients come in, everybody in there is in the same boat. They're all kind of in the same situation, and they become friends.
Have they all had surgery, or they've all had an event?
An event.
Okay.
So
that
and they're
could
all
be
trying to
anything. Okay.
Yep. So they may have just had a heart attack. Yeah. I don't want to take that lightly.
Right. No.
Yeah, but they're all kind of, we have over 100 patients a day we see.
That's very, very impressive. That's here in Central Arkansas. Russellville has its own population.
Yeah, Russellville's already over 50 a day.
That's awesome.
We're in our 4th week. So
I guess it's one of those businesses that you hope someday not to have as many patients. Not that you want to be run out of town, but you want a healthier community.
Oh, definitely.
Because that reaps a healthier, bigger community, city, state. So those kind of things. I know Arkansas Heart Hospital is working toward that. So you do great work here.
Oh, thank you. Yeah.
Christine, thanks for being with us.
Thank you.